so that is how, and once again, following the money is how I ended up at Chapel Hill. Now, here's where you start to get into the like valleys in the real life story. While I was at Chapel Hill, I was debating between family medicine, internal medicine, and obstetrics and gynecology. I liked delivering babies, but I also really liked that it was not rocket science. You know, like what you're supposed to do in, oh, this person's pregnant, but they can't breathe, but the kid's almost ready to come out. The decision-making tree is take a kid out. Like it's not a very like academic side of medicine that's like you're thinking deeply, and so you can master it quite quickly, which is nice when you're a medical student because you can't master anything. As a medical student, you do not know what you were doing at that point in your career path, but you can feel like you've got a handle on it, you know, with obstetrics. And I had kind of moved from peak to peak to peak in my academic career. Like I was really good at school. I still am very good at school. And obstetrics kind of really reinforced that. So I was debating on obstetrics, but not for the right reasons. And I also really liked the most hardcore quote-unquote version of obstetrics is the cancer version, which is called gyn-onc. The long name is gynecology and oncology. They are surgeons, but they also have to do a lot of medicine because they have to do cancer, you know. And so they're like the peak, most hardcore, you know, all your peers will look at you and be like, man, this is a really smart person. Once again, not in it for the right reasons. And then fortunately, slash unfortunately, no, you know, quite frankly, fortunately at this point in my life, I'm able to get there. I was interviewing at UC Davis. They had a combined family medicine and obstetrics program, and I had a headache. It was weird because I'm not a headachy, wasn't a headachy person. Went to sleep, and then woke up in the neuro ICU at Sutter. I had a major head bleed, and they thought I had an arterial, basically aneurysm that had burst. And this was out of nowhere. No history in the family, no history of myself. I am interviewing for residencies at this point. I've completed everything that I need to complete in medical school, and this is where we are. I immediately withdrew all my surgical applications and decided, oh, okay, well, I'll just do family medicine, primary care, and everything will be fine. Pivoted without doing any of the mental health stuff that everyone has told you is important to do. I didn't do any of those things. Went back to school. And then I woke up in the middle of the night with what we call the red flags for headaches. If the headache itself, you know, I'm sure you've had a headache and talked to your doctor, and they were like, did the headache wake you up from sleep? Do you have nausea and vomiting with the headache? Do you have visual changes with the headache? What they're looking for is this an emergent headache, where you have to go to the hospital headache, or is this a headache I can handle outpatient? And I had all of those things. I woke myself up, I was like constantly gagging and vomiting. And when it comes down to people who know how healthcare works, this is ironic, my 4th year, I had 2 different forms of healthcare. I had my dad's healthcare, because praise God, Obamacare had kicked in. I had, to purchase my own healthcare, so I had the student plan before that. And then I also had the student plan. And I knew that my dad, since he worked for the federal government, had the better plan. But I also knew that I could not afford any more healthcare bills after I had my last ICU stay. So I called one of my really good friends and was like, hey, I need you to take me to the ER. I'm not paying for the ambulance. And here's the good health insurance to give them. And I remember like getting there and trying to explain myself to like the secretary admin person outside of the ER. And I don't remember anything else after that until once again I woke up in the neuro ICU. And what had happened, which happens to a lot of Black folks in the ER, is that they did not believe us. Apparently, my friend, he's actually a white dude. He was like, when I told them you had never taken any kind of drugs, like you were one of those dorky kids, and I was a dorky kid, they didn't believe you. So they gave you a more hardcore version of pain medicines because you were like writhing around holding your head, and I coded. I said straight up, I like what you do is your heart rate, those medicines make you breathe slower, but they also make your heart rate go slower. And when you're a young person, if you're in shape, was in shape at the time, this is before residency, your heart rate can slow down to the point that it stops. Fortunately, we have good reversal medicines for that, especially if you're already in the emergency room. So, brought me back, and then I landed in the ICU again. But there are several things. Eventually, that they didn't figure out what was wrong. I was in the hospital for weeks. Nobody knew. They got real mad at my mom because she didn't bring in the CDs from California when she flew in. It was a total disaster. They started taking us a lot more seriously when it turned out that my uncle is a trustee of the school board. And we had to actually fly back, which was covered by insurance, to UCSF, who was like, this is easy, and they fixed it. Had my brain surgery, went back to school, graduated on time, started residency 2 weeks after that. But that story brings up a ton of the things that are wrong with our healthcare system. Like if somebody who knows their diagnosis, knows how to work the healthcare system, is like, at the time I was months away from my MD, if they can't get the care that they need when they need it, and all the medical errors and everything can happen to them. I still ended up in medical debt. I ended up in collections and the whole situation because I didn't have it. Like I said, I was following my scholarship money. If that can happen to them, then what can happen to everybody else? And so that firmed up quite clearly why I was then going into primary care. And so I went into family medicine and I went to LA County to learn. And as you can imagine, you learn a lot. That's where you should train. You should train in the county. You should learn all the things that can happen to somebody, and you will learn them at county. It's kind of like why the best ER programs are in Highland. You will not learn emergency medicine at Kaiser. I've worked at Kaiser, and we're so grateful when we get the people in training from Highland because they're stronger emergency physicians at that point. And the same thing, happened to me going to county to learn that outpatient primary care, when you are taking care of people who have zero resources, can't read, don't speak English, all the things, like you will learn how to properly take care of somebody. And you will really hammers home the importance of taking care of somebody. Diagnosing high blood pressure is easy. It's a number. Like a monkey can do that. It's not hard. Okay? What is hard is convincing somebody to take their medicines. What is hard is getting somebody to afford their medicines, getting their medicines to them. What is hard is getting them to incorporate changes in their diet, changes in their mental health, all of those things. That is what is hard, and that is what is truly necessary in primary care. And it's necessary to be supported financially, systemically, for anything to change. All of these disparities that we talk about aren't going anywhere until all of that stuff is paid for. Like I had insurance, right? But I knew that one insurance was going to pay for everything and the other one wasn't. And that's, the federal Blue Cross Blue Shield PPO is the best plan there is. If you know anybody that works for the Department of Defense, see if you can get on that plan. But other than that, I had paid for the Platinum Kaiser now, and that's because all of this has happened to me, so I know that I'll be right back in collections again, if any of these things happen again. None of those things in that system have changed. I think COVID made it very clear to all of those who were not in the healthcare system so many places of our brokenness. And unfortunately, we have not learned our lessons, within healthcare. So I think the best thing that I can do in talking to people, especially talking to adults, is actually teaching them how to navigate healthcare in real life. Yes, some of it is, navigating your illness. Yes, you should take that medicine. But like I said, that part's, I can do that in my sleep, But telling you how to not end up in the same situation that I was in, that is going to be what is more important. Since residency and chief year and all that hoopla, You know, I wanted to do full scope family medicine in an urban underserved environment, and tried to do that for a couple of years, got burnt out, left, went to the hospital because that feels very comfortable for residents. We spend a lot of our time training in hospitals. So it was easy to go back to that. And then COVID hit and they wanted volunteers to go to the critical care unit. And so I said, yeah, sure, you know, I still remember how to run a ventilator. And I did, because I'm a goody two shoes still. And so I've been in the critical care unit ever since, trying to get out. Take me back to clinic, you know. Dude, I don't know, I have no idea. Myself and the lady who was from the Lymphoma Society were both, you know, lamenting the things that we have done in healthcare and kind of where we are now. But the biggest key and the biggest thing that I can do to help any of you guys, quite frankly, is teach you how to never see me at work. Okay, like I said, I work in the critical care unit. By the time you get to me, things have gone terribly wrong. Okay, and they've gone terribly wrong, typically multiple times. Okay, by the time you get to me. So the best thing is to prevent you getting there. Like I was telling my Uncle Rodney, every study that we've done has shown that the key to not ending up with me, you know, on that ventilator is actually health literacy. Okay, people talk a lot about socioeconomic issues with healthcare. That's true. Okay, but I can't change the fact that you're brown or you're a woman or you're trans or how much money you have. I can't do any of that. What I can change though is how much you know about your own health, okay, how you navigate the healthcare system, how much you know about health insurance. Okay, covered does not mean free. Okay, and how we can change a lot of those things, both with yourself, but also the importance of changing them systemically. People don't realize that before Obamacare, mammograms and colonoscopies were not covered by Medicare. These are routine screenings for seniors, not covered by Medicare, and Obamacare made them covered. Okay, before Obamacare, there were not global electronic medical records. They made them required that we kept records on computers. Okay, there's all these little nuances. Okay, and those are things that you need to know. You need to know yourself and be like, hey, you know, I'm kind of a telemedicine person, or I'm a person that can't stand telemedicine. I want to see my doctor in person. And which plan is good for you there? And so those are the things that I think that it would be more helpful that I talk to you guys about. But I can also talk about, you know, how I got here more, you know, if you want to know that side as well. Do you guys have any questions? Go ahead.
Since the pandemic, are there any changes to the HIPAA laws? People have more or less access to your records?
No changes at all. So HIPAA is actually why you still have to unwittingly fax things in medicine, right? So HIPAA was enacted federally back in like the 80s. Okay, it was kind of right when EMTALA started. I'll explain that too. And essentially, HIPAA was about privacy, you know, which is good. You know, all that part was good. The trouble was email was kind of just taking hold, like it didn't quite have the hold that it has now. And so they're so specific within the HIPAA law that nothing was considered secure except for the fax machine. Okay, and so that is among the reasons why if you go to one hospital and then you go to another hospital and they're not in the same system, they don't talk to each other. You guys are like, oh, it's all on the computer. And we're like, yeah, cloud technology was not a deal during the 80s when this law got made. So actually that will require a change federally. And you know, our federal Congress is having some challenges agreeing on anything except the Defense Department budget. To change some of those laws. Some of the, you know, obviously most of HIPAA is good. Also, the other big concern about HIPAA at the time was that was when the HIV and AIDS pandemic was happening and a lot of stigma around that. And so a lot of the privacy rules are also based around not telling anybody's mental health history or sexually transmitted infection history, which has actually resulted in problems, you know, because then as soon as, once again, if you're at Kaiser and then you go 2 blocks down the road, etc., they don't know what happened. Other questions? Go ahead.
Great presentation, Dr. Carey. I was told that the cap, after 75, the insurance company.
That's true.
Oh.
Essentially, so who makes these guidelines? The United States Preventative Task Force, okay? And they are similar to the CDC, very reactive. Now they have to be, because if you think about, like, these are huge data sets, like hundreds of thousands of people, whether something did good or did bad or whatever. So just like, you remember how during COVID, like, people would be like, oh my God, the CDC just changed their mind. And you'd be like, yeah, but that's because they had to wait till they got all the local public health data, and then they had to aggregate it and that. And by the time it gets to the CDC, things have changed. That's the same thing with the United States Preventative Task Force. Okay, and they're the ones that set all of these big guidelines, especially as they relate to cancer screenings. Okay, and so when you think about a guideline that says, let's stick with colonoscopies, okay, that you're supposed to start at 40, okay, but if you have a first degree relative 10 years before them, and then you stop pretty much everything at 75, okay, that is because those are those recommendations. Now mind you, those recommendations are not based on whether or not we think you will get cancer, okay? A public health recommendation is based on, yes, there's the cancer, but also what is the treatment for that cancer, okay? And what's the cost? Quite frankly, public health includes costs, okay? So we will say that, okay, if you get diagnosed at stage 1 cancer at 75, even if we did absolutely nothing, you would probably pass away at 85. And you'll probably pass away at 85 anyway. So what is the point in screening you? There are risks in screening, right? So doing especially a colonoscopy, there's a risk of us perforating your colon. Okay, there's a risk in anything in medicine, right? You take Tylenol, there's a risk, there's a risk of everything. So when we're weighing out those risks and benefits, there are costs. If I perforate your colon, now you gotta go to a surgeon, forget the gastroenterologist, so hopefully you have this done at a hospital, but if you were done in an outpatient center, which is perfectly fine for colonoscopies, then now we have to get an ambulance. Now the whole thing costs $100,000, okay, and you've got an ostomy. This is a disaster, okay? There are harms associated with screening. For every 100, of those we do, 2 people are gonna get perforations. And once again, if you're talking about 100,000, these data sets are huge. So then they're like, is the risk worth the fact that I'm gonna diagnose you with something and you are still gonna die, no matter if I treat you or not, by 85? And so that is where those kinds of recommendations come from. Now the big controversy about that is that people are living longer, right? Nobody is like dying of the measles unless you're like unvaccinated in Orange County, okay, anymore. That's not a thing that's happening, okay? And so because of that, our water is cleaner, our nutrition is better in terms of quantity, in terms of like nobody's like malnourished in the United States on average. We talk about big aggregate numbers. Okay, so people are living longer. Okay, because people are living longer, probably need to revise a lot of those data statements. But it's going to take years. We're doing the research, but it will take years before they change.
Can you speak to mammogram?
Same thing with the pap smears. Everything stopped at 75. And pap smears, so we've really backed off on. Okay, so very quickly, and this is applicable to dudes too, because that's why people need pap smears, okay? So cervical cancer is the largest cause of cancer death in women worldwide. It's cervical cancer. People in the US hear a lot about breast cancer, but it's cervical cancer that kills the most people, okay? The disease that causes cervical cancer is a sexually transmitted infection that in all likelihood you got from a boy. Okay, it's called HPV. HPV is a sexually transmitted disease. It is a disease that causes no symptoms except for cancer. So the trouble is you will not know, okay, unless you get pap smears, okay? And this is unfortunately something that we learned, that vaccine was coming out when I was in the beginning of, so this was 2004 was when that vaccine was coming out, and it was not covered by insurance. okay? And it was only covered for women who were like over 18 and had less than 3 sexual partners at the time and all this stuff, okay? And now we're trying to get everyone to get it, and like most vaccines, ideally before one starts having sex, because then you won't ever get the disease, and then you won't be able to transmit it to anybody. And so you're trying to get ideally your 12-year-old boys, okay? Which is like, that is the art of primary care. Trying to convince that parent, I know you think this child's never going to sleep with anybody, and has never seen pornography, and it's just this, none of it is happening to your baby, okay? Even though everybody else's baby is having to, but they need to get their sexually transmitted infection vaccines at 12. So in either case, the recommendations are, because we did a good job with those vaccines, and because we can now test for HPV, we used to not be able to test for HPV while we do your pap smear, the guidelines about how often we do pap smears have changed. Okay, so they used to be, 3 years after you started having sex, or at 18, and then it was yearly, and then it backed off to 3 years, now it's backed off to 5 years, and now it depends on whether or not your HPV test is positive. As you can imagine, once again, you don't get cancer if you don't have HPV and if you got the vaccine, and so then you back off even more. Okay, and once that is very strictly in the United States. Also, once again, because of how easily we can treat cervical cancer and how slowly it spreads. So once again, if you got cervical cancer for the first time at 75, you would die with cervical cancer, not from cervical cancer.
Well, we want to thank you. We want to thank Dr. Minicherry for her valuable information. We're so happy to have her here representing the Bay. While everyone is still seeing, I think you had one burning question?
I do, I'm sorry. Just for everyone, is there like an online resource where people can learn more about their health insurance coverage?
So you're asking your question, is there an online resource for people to learn about the health care coverage?
Quite frankly,
It's going to be going to the website of whatever healthcare coverage you have, and ideally speaking directly to the member services. Okay, so Kaiser has market penetrance in this area, that 70% of all people have Kaiser. Kaiser is going by the U.S. Preventative Task Force. There's no way they're doing extra screening. That is not a Kaiser thing. Okay, and so but if you just talk to member services, but of the insurance that you have. So if you have Anthem, Blue Cross, whatever, talk to the member services, and they will not only tell you, what's covered, what's not, but also what additional you will have to pay. But you have to physically call them.
All right, thank you again. Let's give Dr. Minicherry another hand. We have gained so much information, and we need to have a little bit more movement. We had some yoga and meditation earlier, so we want to just kind of go back into some movement before we end with our next intellectual, educated presenters who's going to give us some more intellectual knowledge. I want to begin to introduce our next presenter who is going to give us some movement, and that is Marcus Gary. Marcus Gary is a Qigong instructor, yoga, and he does yoga and meditation. He has over 29 years of experience in application of holistic living and wellness as a member of the Asset Society. He has 21 years of experience doing Qigong and has experience in Chinese medicine. Marcus has taught classes in San Francisco, Sacramento, Los Angeles, and is currently an instructor in Qigong. Is a team on board the Holistic Holiday Seed. Let me say that again. He is a holistic Qigong instructor, and he's a part of the Qigong team on board a ship. And this ship is called the Holistic Holiday at Sea Vegan Cruise. And I'm happy to learn about this vegan cruise. So thank you, Marcus, for joining us. And Marcus is one of our longtime supporters and presenters for the Festival of Knowledge. So we're happy to have him be back with us.
Thank you. Thank you very much. So, all right. thank you, Doctor, for opening us up, because now we see how important it is. That it's a wonderful segue into why it's important to take care of yourself, right? And you need to make sure that you have multiple ways that you take care of yourself. You need to know the path of the Western medicine, and you also need to know the path of the ancient medicine as well, or the Eastern path. Okay, it's a holistic process, and so a little bit about my background. I've been studying Qigong for, I don't know, since I stopped even counting now, 20 plus years, and so my background is I studied architecture and I practice that now, but at the same time, I always recognized that there was something else about health. I had a little brother who had cystic fibrosis, all right, and he actually passed from it. And so it really gave me a hypersensitivity to wellness. And so I learned Qigong as a form of healing that is ancient. It's an ancient history, ancient form. It's thousands of years old. And so I always tell my class, I says, if something has been practiced for thousands of years, then it's got to have some truth to it, right? I mean, you'll throw your phone away if it's broken, if it doesn't provide you no service in the day, right? So if something is not going to work for you, you're not going to use it anymore, okay? And so this is a practice that has been taught. It's in China, in the hospitals. But I also, in my classes, I really want to make sure people know, and I've got some images that I brought with me, that this study was brought into China by a black person. Okay, Bodhidharma. You can Google this, all right? Because this is the person who doesn't know their history. You know, this person was a black Indian Dravidian, came from India into China and brought the study of Qigong. Okay, so this is you studying your own history when you're practicing, and then the Chinese become credited for being the custodians of this understanding, which is fine. We have no problem with you holding it and taking care of it, but know where the origin is. All right. So the form that I'm going to share with you today is medical Qigong. So there are let's and I'm going to have everybody stand up, but I just want to have everyone think about this concept right now with me for a minute. There's two parts of you, okay? Didn't know it, but there's two parts of you. If you're having a conversation right now in your head, there's someone speaking and there's someone listening. You cannot hear what you're saying if there wasn't a receiver. Check this out. Follow this with me, okay? So there's two parts of you. There's a part of you that is an energy vehicle. There's an energy part of you, all right? And then there is a part of you that is consciousness, okay? All right? Now, because there's two parts, we have to treat both parts, okay? And so the emotions that we experience, depression, sadness, joy, all those, that's the energy vehicle, okay? But that's not who you are, because you can change those things, okay? Who you are is that part of you that can see and witness and experience that energy, okay? So this is the reason why it's so important to study energy medicine or exercises, because we have to treat that energy. We have to learn how to treat that energy within us, okay? And so I'm going to share with you some sounds, and I'd love for you all to practice them with me. And they're because in Chinese medicine, all the energy is mapped to an organ system, okay? And so, like, for example, anger that energy of anger is mapped to the liver system. And we've heard this before. We've heard the angry liver, probably. You've heard, maybe you have that abstraction. The liver, a good liver chi is somebody who is relaxed. Relaxed in the face of challenge. Relaxed all the time and not angry. And anger is what poisons the liver. Okay? And so, check this out. This is deep stuff, y'all. In Chinese medicine, we treat the root of the tree. Okay? Alright? You treat the root instead of treating the leaves of the tree. You treat the leaves when you have a headache and you go grab yourself an aspirin. Okay? So you got to treat that. But note, there may be a root source why that headache has even occurred in the first place. Okay? Because when the roots are sick, the leaves fall off, the tree dies, and you can't, if you don't treat the root, you're going to end up destroying the whole structure of the tree. In Chinese medicine, we treat the root. Okay? In Qigong, which is related to Chinese medicine, we treat the root. So I'm going to share with you a sound that's going to treat the liver system, okay, which treats the entire tree that the liver will provide you with. So like I said, good liver chi, you're relaxed in the face of challenge. You're also able to be very creative, okay, because of that relaxation, okay. So what I'm going to have us do is I'm going to do some sounds work with us now. So if you can stand, great. If you can't stand, you can stay seated and do it. All right? Because this is for, y'all, this is about health, and so, like I said, they use these sounds in the hospital. So some people just have to be in a bed doing it. Okay, so there's never a reason why you can't do your Qigong exercise. Okay? All right. Are we all good? All right, you rolling with me?
Yes.
Okay, all right. So, first, we're going to learn how to breathe. Okay? Now, where do you breathe? Anybody? Where do you want to breathe in your body? I see you grabbing it. Go ahead, grab that abdomen. It's okay to have a pot belly today, y'all. All right? I know it's not a sexy thing, but it's okay to have a pot belly because that's where you're going to breathe. Not up here in the upper chest. Okay? Upper chest breathing is you see kids, mom, where are they breathing? They're all up here. They say, come on now, bring your breath down into your gut. Okay? Breathe down here. Now, why do we want to breathe down here? Doctor knows there's something called the vagus nerve. All right? The vagus nerve, and this is, y'all Google this. The vagus nerve is the longest nerves in the body. It connects your head, your brain, to the rest of your body. When you breathe from the lower abdomen, what you're doing is you're sending an impulse. You're controlling. This is the reason why they tell you to, hold your stomach in or give some tension to your belly, and it helps to zap emotional response. It's phenomenal. And so when you're breathing from down here, let's just do it. Put your hands over your belly. I won't look at it. You're going to push your belly out. No one else is looking at your belly. Don't worry about it. This is healing, y'all. Come on now. Push your belly out. And when you push your belly out, you should bring air in. Because you can think of a balloon. When a balloon expands, air is coming in, right? So when you push your belly out, you're going to automatically come in. Air is going to want to come in, okay? Pull your belly in, but slowly contract the belly as it is coming in. Slowly, resist pulling it in is what I mean. Slightly. So breathing in, pushing it out. And when you breathe out, you're going to pull your belly in. And you're going to slowly resist the belly coming back in. Okay? And what that is doing is exercising the vagus nerve. Okay, pushing the belly out again. And slowly pulling the belly back in. One more time, breathing in. Slowly pulling the belly back in. and you're gonna count mentally to 4. Rhythmic breathing, right? So 4 count in breath, and 4 count out breath. 2, 3, and 4. One more time, breathing in. 2, 3, 4, pushing the belly out. Breathing the belly back in. 2, 3, and 4. Okay? So that exercise alone is super important. That's good Qigong right there. That exercise. Learning how to breathe, it's super important. There's tons of great information out there. Breathing is so important. Does everybody do some breathing? Like conscious breathing. Not like I'm breathing now because I'm alive kind of breathing. I'm talking about conscious breathing. Like take a moment, take your 5 minutes, okay, and consciously make an effort to breathe. That's gonna change your life. Thank you for yawning back there too. Yes, okay? You gotta get that oxygen in. Take that oxygen in, okay? So that is conscious. Well, every day, y'all, I want you for the next 21 days, you create a habit by doing something for 21 days. Spend 5 minutes a day breathing consciously. Okay? Take your time, put your phone down. Keep the phone up, put a 5-minute timer on, okay? And just do your 5-minute breathing, okay? So that's an important piece, all right? I always like to walk away with something so you can not just show up in the doctor's office right there, because you choose to go see the doctor. Choose to see the doctor, not by force, yes?
Really quickly, so you develop an abnormal heart rhythm that's too fast, it's called SVTs. The treatment for that we do in the hospital, that I do as a critical care doctor, is to make you breathe out, try and push out a plunger in a syringe. So this breathing exercise is what I would make you do.
There you go, look at that. Fist bump, look at that. See, that's what I'm saying. That's what I'm saying. Very important. Okay, so that's one thing we're going to do. We're going to make sure that we breathe. Now, the next thing we're going to do is we're going to change our response. What we're going to do is so this is another piece that I want to share with you all, okay? Your action is controlled by your thoughts. Okay? Absorb this for a minute. This is all connected. Your thoughts move your energy, which creates action. Okay? All right? So we know this. Every time you've done anything in life, you've thought about it first, right? You had a mental thought, you had a visual, you had a verbal thought, and that affected your energy, and then that affected the way you responded. Okay? This is like, we're doing this all the time. Okay? And so, when I respond in an angry way, okay, there's some thought process that I had that made me have that response. Okay? And so, what we're going to end up doing is we're going to train ourselves to not see that anger as the anger is not who I am, right? That anger is basically saying that my liver needs some support. Okay, that's really what it's saying. I'm going to strengthen something within me. It's like when you drive your car and you get an indicator light that comes on in your car, it says go to the shop, right? That's an indicator light. Anger is an indicator light for something that you need to fix within your energy vehicle. Does that make sense? All right? And they're indicator lights. Each emotional response is an indicator light of some organ system or some root system that needs to be fixed in your body. So when you begin to change the way you think about these things, your response is going to change. Okay? And so now what we're going to do is I'm going to share with you a sound that's going to chill that liver energy out. And the sound is shoo. S-H-U. Shoo. Everyone got one on their foot, right? I got a sandal. Sorry. All right. You got to shoot. Okay? So you're gonna remember this. Remember that sound. Okay, you remember Ella Fitzgerald? Anyone ever heard of Miss Ella, right? She got, Memorex, is it live or Ella, right? So she sang a song, and what'd she do? She broke some glass. So we heard that the sound can have physical effect on something, okay? So this sound has been studied for thousands of years, has a physical effect on something. That something is your liver system, okay? So now what I'm gonna do for us, we're gonna do a demonstration. It's kind of hard to do with holding the mic. So I want everyone to take their feet shoulder width apart, okay? And I want you to place your hands over your belly, okay? I know, it's a lot of belly action, okay? Place your hands over your belly, okay? All right? And make sure you smile. Even if you got a mask on, you want to have a smile on your face, okay? Because that makes the energy flow much better, okay? Just throwing all kinds of little secrets out there, okay? Place your hands over your belly, okay? And the sound is shoo. So, let's do this too. Bring your knees forward slightly. So it's almost like you're dipping, so you're just gonna get into a little dip, okay? The reason for that is when your legs are straight like this, there's too much tension in the legs, okay? Just gonna bring them forward, just like this, okay? Drop your shoulders, a little tension, all right? All right, gotta check y'all, okay? All right. So you're gonna release the sound shoo. So you're gonna take a deep breath in, and you're gonna release the sound shoo. Breathing in, shoo. Now remember how when I taught you how to breathe the first time. Slight tension when you bring it's the same exact breathing, slight tension resisting the in breath. So the out breath, excuse me. Breathing in. Breathing in. Very good. Breathing in. Breathing in. Last one. Breathing in. Very good. Take a deep breath in and breath out. Okay? So now, that was a demonstration. We want to work that sound 25 times, 50 times, right? Chi means energy. Gong means cultivation. Okay? So cultivating that energy. So 25, get that energy flowing. What that sound does, it helps to remove any of the blockages. How does it feel? All right? It's a very relaxing sound. My experience with has always been it's a very relaxing sound. Remember that good liver energy is one who is relaxed.
Does it matter what tone you do the shoe in?
Oh, danger, educated black man. All right, yes, sir. Yes, sir. Yes, sir. Yes, it does. But we can't get into that right now. But get it in. Get it in. Yes, yes. When we teach the class, we teach each sound has a note, but we're not going to get into that level right now. Trust me, you're not going to do any harm. Okay. All right. So thank you very much. That is very important. So what's the sound? All right. And what is it that you're going to do every day, 5 minutes at least? You're going to breathe. You're going to learn you're going to practice. We're talking conscious breathing. Do it for 5 minutes and expand it, okay? You should be able to get to a point where you can do it for 30 minutes. Conscious breathing, and I'm telling you, life is will open itself up to you. Okay, there's different sounds for each organ, and I have a sign-in sheet over here if you would like to get some information and find out about classes, ongoing classes to learn those other sounds. And thank you very much.